We actually had an issue with violence in the workplace that nobody talked about. It almost become an accepted norm. One day, chatting with one of our security people, the true magnitude and scale of the issue was brought to my attention in terms of real numbers affecting real staff.
When it comes to a violent situation where there are people, could be patients, could be visitors, could be just somebody on the outside coming into the hospital for whatever reason.
And so with that as sort of the starting point, we quickly went on a journey of zero tolerance and violence reduction, increased safety, which is good for our staff but also for our patients.
It's a safety device, that's how I see it, as something that I know that once I have this on, I'm a lot safer than without it.
When someone double taps, you hear a tone. It opens up the security channel to everybody in security that's wearing a badge, so we can all hear the conversation that's going on. So if there's any speaking, you would just hold down your button and you would ask if they need help, if they need security assistance. If there's nobody talking directly to you, but you can hear like something's happening, you can always have one person put it on hold, request where the location is.
Vocera.
Locate Nikki Gagne.
Nikki Gagne.
Is near.
G48P3. G4D.
Rejoining your call on hold.
And you can actually physically go up to where they are.
This is a very useful tool that we use in the ICU frequently. The issue with some of these patients that are not normally violent or have absolutely no history of being violent, when they wake up from being sedated or wake up from being anesthetized, they may become very difficult to deal with or combative and confused, and can put nurses' safety in jeopardy.
It significantly reduced our response time on a code white. We've dropped the response time by 61%. And are now able to have security officers on the scene after the device has been activated in just under a minute.
The value is very simple. It comes down to life and life safety.
Rapid response by security has either allowed for de-escalation or for the intervention so that the person who was escalated was stopped from injuring a staff member or another patient.
The Vocera has just kind of completed the scope that we needed to make our program complete. We've now got all the different pieces, components, to make the program better.
This has sort of been a fascinating process of discovery, in that what started as sort of purely a safety initiative has become much larger, and we're still learning how to take further advantage of the technology. So I'm sure in a year's time, in 2 years' time, we'll have an even better story to tell as we really change how we do our work, given this sort of a communication tool.